Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi there, I'm Dr. Carrie Bennett, and I would like to give you my offering regarding the different types of biopsies. There is an incisional biopsy and an excisional biopsy. An incisional biopsy, if you think of a loaf of bread, an incisional biopsy is when we take a few slices out. Say we're looking for mold on the bread. We're going to take out a few slices and we're going to say, is this bread moldy or not? Those samplings will give us an idea. An excisional biopsy would mean that we're taking out the whole loaf of bread. In breast disease, there are things that we feel and there's things that we see. If you have a mammogram or ultrasound, but you have a mass that you can feel for more than 3 months, that is what we call persistent or palpable, that still needs an incisional or core biopsy. So if you have something seen that's abnormal on mammogram, usually microcalcifications, which come from cells growing and dying and our immune system popping open the cell, letting the calcium out, then you need a mammogram biopsy. If it's only seen on ultrasound or best seen on ultrasound, often things on ultrasound are also seen on mammogram. An ultrasound is an easier way to perform a biopsy. You do an ultrasound guided biopsy. If it's only seen on MRI, we do an MRI guided biopsy. A mass that is felt by you or a clinician that lasts for more than 3 months, that stands out from the rest of the breast tissue, will often need a biopsy. But 80 to 90% of palpable masses initially will not need a biopsy because with the breast health information, the sheet, you can look at that talk, fiber, fluid, exercise, stress management, good sleep, changing your bras and washing your deodorant off. 80 to 90% of breast masses, especially in menstruating women who still get their menstrual period, will go away in 3 months with those 7 items that we talk about in the breast health information sheet and talk that you can reference. So if you have a biopsy, an incisional biopsy takes out just a piece of it, an excisional biopsy takes all of it out, and we use the modality where it's easily seen to biopsy it. And if it's persistent and palpable and stands out from the rest of the breast tissue, even if we can't see it on imaging, it may need or likely will need what we call a core biopsy, where we take one of those slices out. So those are the major ways that we do biopsies in breast disease and the difference between an incisional and an excisional biopsy.